Hello, good afternoon, good evening, and welcome to episode 31. Can't believe we've got to 31 already. My name's Richard Ashwood, registered nurse, out working at my clinic called No More Earwax, which is in the UK in the northwest of England. This patient, 2 ears today, not 3. This lovely lady came to see me about a week ago. And I didn't post this one when I first saw her, because it was one of them that when you first see, you think, oh, this might be a two visit job. This, it was absolutely rock solid. And whilst we managed to get a bit out, couldn't get the whole thing out, so we sent her away to get a lot more oil in there. So hopefully it'll make it a little easier, because you can already see bits of the eardrum there. So she did say that she could hear a little bit better already after seeing me last week and after applying some more oil, but quite a lot of this remained. This was one of my least favourite types of wax. There's a few. There's the one that's like a brick, like a pebble, that's really rock hard, and then there's this type, which, as I've titled it, Treacle. Now, Treacle, I don't know if it's a thing in the country, but Treacle, it's like a thick black chewy toffee that we have over here in the UK, Treacle toffee, and it's it's gooey, it's sticky, and it's really difficult to remove. Now I don't know why, but everyone in healthcare, we always seem to relate things to food, don't we? If you've got growth or something, they say it's the size of a grapefruit, it's the size of an orange, and the consistency of things we seem to describe with food. I don't know why, but people in healthcare, especially nurses, seem to be a little bit obsessed with food. It's probably because we don't get enough time to get any sometimes. Or the food that we do get, this is one thing I do miss about the working for the NHS in my old job, is got lots of presents of chocolates, toffees, candies. That's wherever you are, candies make more sense than toffee. And chocolates, and I do miss that, but I've lost quite a bit of weight since I left the NHS. So as you can see, this lady, while she'd had a good old bit of oil in while she was at home, wasn't too keen to have any more oil in during the procedure, because when she'd been putting the oil in, she felt it'd been blocking things up a bit more, and I tried to explain that it would probably help with this, make it slide out a little easier. She was extremely nervous. It took a lot of reassurance, quite a long procedure this was. I didn't want to rush anything, I never rush anything. But I was trying to be extremely slow and careful, and kept reassuring and talking to the patient, make sure everything was okay. Because the last thing you want to do is for anybody to be uncomfortable. It can be quite a daunting procedure when you show people all these sharp little instruments and you think, that's not going anywhere near my ear. But those of you who like a bit of a satisfying peel, you might enjoy this one. So you can see I kind of grabbed that one from the side there, and I'm trying to bunch up the other bit in the other side there to peel it away from the canal wall. And you can just see underneath there, there we go, that it is starting to lift, but it is so sticky. It's proper stuck. Like I said, I know the oil would have helped, but obviously you have to reach an agreement between the patient what you think would be best and what they're happy to have. But I was still fairly confident that we'd managed to get the majority, if not most of it, all out. It just might take a little bit longer, but I know you guys like a bit of a longer one. So here it is. Again, thanks for all the comments that were received over the last few days. Really enjoyed reading where you're all watching from. Let me know where you're watching from again. I think I've had one from every continent in the world now, apart from Antarctica. Now, I don't know if there's any scientists or researchers in Antarctica. I don't know, I'm looking out the window there, there's nobody there. If there's any researchers or scientists watching in Antarctica in their spare time while they're looking at penguins all day long, if you are, leave me a comment down below. I doubt that'll ever happen, but hey, it's worth a shot. Then we can say we've got all corners of the world covered. Just come out there again and keep on to go out to rinse the tube, because it does get a little bit stuck sometimes, especially with this type of consistency of wax. I've not seen anyone post any of these duets yet, by the way. I don't know if anyone's figured it out yet, or they've thought, I'm not doing that. But I would be interested to see if you can do this only on TikTok, by the way. I'd like to see your reactions to this. It'd be fascinating. So, right, what can we talk about? We talked about the... I know, right. Now, my past job, which I've mentioned a few times, but not in much detail really, was I was a district nurse. Now, a district nurse, for other countries, it might not be called, but it might be called a community nurse. They're traditionally the nurses that will see patients in their own home. Not always, they do work in clinics as well, but they see patients in their own home. Now, I like to think of them as the forgotten frontline, because those district nurses are often the people who keep people out of hospital in the first place, which is really important. In any case, if someone could get some treatment at home, why wouldn't you, rather than going into hospital and taking up a bed, you know? So what do? In a simple answer, what a district nurse does is everything. And that's why I enjoyed being one. Work phone's going off. Someone asks me if I do all these in one take, no matter what happens, and yes, I always do. No matter if I think I've made a right pig's ear of it or a dog's dinner of it, yes, I do always do it in one take. Anyway, what was I talking about now? Yeah, district nurses. So yeah, they do everything, and that's why I enjoyed it, because you had to learn pretty much every single nursing skill and nursing procedure to be able to do the job. So you've got to be pretty confident in your ability and be able to pick up absolutely anything and kind of think on your feet too, because no 2 days are ever the same. Give you an example. A typical day for your average district nurse, certainly in the UK, would be the first, say, 3 or 4 patients you might see might be diabetic patients who can't, in some instances won't, administer their own insulin, so you need to go and see them first. But they've got something to eat, check the blood sugar levels, report any issues to anybody, but to give them their insulin. After that, say you may go and visit someone to give them medicines via a tube in the tummy. That's called a PEG tube. It's a tube that goes straight into the stomach, because some people can't take medication orally for some reason, but it doesn't need to be done through a drip if it's long term. So they have a little tube, and they pop the medicine in a syringe and pop it in there. That was quite common. Setting up feeds. Now these are bottles of feed, again, for those people who can't eat for whatever reason, so they may have a swallowing issue. You'd be setting the feed up there and starting the pump off to get them going for the day. And then from then on, it could be literally anything. A lot of leg ulcers. I used to love a good leg ulcer. Quite labour intensive though. Washing and dressing these legs and putting sometimes 4, even 5 layers of bandaging on each leg sometimes. Absolutely did my back no favours at all. Don't miss those. Then you could have people who've been discharged from hospital who say need some stitches removing or need some staples, clips removing. Then you might go and see someone who's had surgery. We used to get quite a lot of open wounds, and we used to have to pack those daily. So you had a wound that was like, say, that deep. They used to sometimes leave them open, so they would heal rather than stitch them together, they'd leave them open. And so then you would fill it with a special dressing, and then it allowed the wound to naturally rise up from the inside out, because there's the risk of it collecting fluid. If you close it over, you need to leave it open, and it naturally, over time, rises up to the surface and closes over naturally. Those are quite labour-intensive ones, but seeing some on all kinds of strange parts of the body, you know, and the back, in between the bum cheeks, is probably one of the most common ones we saw for those. Then you could get called to see a catheter. Catheter changes, not always done by nurses. There's sometimes doctors or urologists in hospital, but you've got all district nurse. No, they learn how to do that, and they do that in someone's house. And then the one thing I do miss the most it's quite a satisfying one, this. I got to see quite a lot of people who had terminal illnesses, like cancer, heart failure, COPD, and a lot of people, and why should they, want to see out the last days at home, surrounded by the family. rather than in a hospital or a hospice. And we used to do that quite a lot. And it was very, very challenging, obviously, but very rewarding. Where you used to have to do all the care on people while they were usually mostly bedbound. You have to get pumps going to deliver medication to keep them comfortable. And I was a nurse prescriber as well. I still am a nurse prescriber. So I could prescribe any emergency medication as and when it was needed. Then after that, you might do some more of the medications through the tube on the way back for the same person you've seen in the morning. And you might do some return insulins for people to have their insulin just before tea. But the long and short is there's absolutely nothing that they didn't do, and they kind of get forgotten about a bit. And I think they deserve a lot of kudos and a lot of credit for what they actually do, because it's kind of a misconception, especially here in the UK, that what they used to do. There was an old programme, what was it called? Open All Hours. And they had this nurse in it called Nurse Gladys, and she used to ride around on a push bike, visiting Betty, have a cup of tea, how's your legs? Yeah, the legs are all right. And it was classed as like a job where it was a bit relaxed, a bit laid back, but that's far from the case. It never has been. A lot of skilled people who work in that job now. There's just not enough of them. Part of the reason why I left, unfortunately, as there is not enough nurses everywhere, to be honest with you, but especially here in the UK. People like me abandoning ship. All right, that last one there. Now, there was still a bit left in there. Now, I think by this point, the lady had had enough. But we've cleared the blockage. You can see all of the eardrum. And I've just given her a routine with some oil. So hopefully it's not going to build up again at any point soon. But more than likely, she'll need to come and see me again. Maybe 6 months, 9 months. Probably a year tops, you know. And this was the second one. And yeah, you'll see some bits left behind in some videos, and you're like, oh, why is that one not getting respect? If there's absolutely no need for you to be inside somebody's ear because you've cleared the blockage and you've fixed the symptom, there's absolutely no need to be in there any longer than you need to. Sure, it'd be nice to get every little last speck out, but there's absolutely no need. You need a little bit in there, but as long as you've cleared the blockage, you've relieved the symptom, anything else after that is a bonus. So yeah, this is the second ear. Oh yeah, what I want you to tell me this time in the comments. Now, as I've talked quite a bit about nursing, those nurses have quite a dark sense of humour. You have to get through the day sometimes. So we have quite a few little couple of nurse jokes, and I want you to tell me your jokes, healthcare jokes, down below. How many nurses does it take to change a light bulb? No, how long does it take a nurse to change a light bulb? Just one, but it'll take them 5 minutes to change it, 20 minutes to write about it, 2 minutes to do a risk assessment about it, and 10 minutes to write down all the serial numbers and batch numbers of it. One of the most frustrating things was all the extra bureaucracy and paperwork and what have you that we had to do. I get that it was there for a reason, a lot of it. Well, there was a shortage of the local maternity unit ran out of nurses the other day. It was a midwife crisis, but thought you might like that one. Another dad joke. Kids go absolutely mental at me. Oh, dad. But I think it's a dad's right to tell the worst dad jokes in the world. Mine are certainly awful and terrible. But yeah, tell me yours. You've got any dark humour related to any healthcare issue, or just any jokes in general? Because you need to take life a little less seriously sometimes, don't we? We all do. Now, there wasn't as much in this one, and it was very close to the outside, which was quite narrow there, so it didn't need to go deep down into this one at all. Managed to get the majority of this one the last time. Some patients, it can take a couple of visits. I'd say there's only a couple, maybe 2 or 3 I could think of over years that's actually took more than 2, but maybe 1 in every 50. You need to just admit defeat and say, let's go away, let's get this a bit softer before we can get out the next time. Obviously, no point bashing away at something when you think, oh, I'm not going to be able to do this. Let's just give in for now. Go away, get some oil, and we'll get it out the next time. And that's almost always the case. This one's putting up a bit of a battle because it same consistency as the other one. It is just so sticky. Hopefully I've not put anybody off Treacle. There we go. And that is pretty much that. Oh no, it's not. A little bit left over at the side there. So, I hope you've enjoyed this one anyway. Hope you've enjoyed having a little chinwag. Another word for a chat, by the way. Always nice. Yeah, leave me some comments down below, and don't forget, if you enjoy these type of things, I'd love it if you could give us a heart, give us a like, leave us a comment, or subscribe, or follow the channels, whether they're on TikTok, Facebook, YouTube. Appreciate all of them so far. And thanks for watching. But until next time. Oh, one last thing I was going to do. Yeah, you know this thing, when I edit my videos, there's a thing that you can use to phase from one screen to another. Like you can fade it, or you can zoom one in from the side, you can zoom one in from above. So I'm going to try one. I'm going to try, not a fade out this time, I'm going to try something different. I'm going to zoom that way. So for now, take care of yourself, and I will see you on the next episode. Ta-da! Right, let's go this. No, that way.